Superb.
Structured.
Concentration.
Crazy.
Science, maybe. My last 15 months in the TMC was a very busy period of my life. I worked a lot also in my workplace when I had free time to do it, and the background, so the help from the TMC group, especially with my mentors, with the team of the statisticians, were very helpful. So that is a key point from the success.
What I most appreciate in the program, that it's very well structured, there are very clean expectations, and it's nice that I can define what I learned, what methodology I can learn, what is the motto I learned doing by practice.
For living with the emotions and the stress, I think a work-fun balance is very important. There were times where the labor was actually so intensive that it did get stressful and difficult. But I think everyone knows that a PhD is like this, and you can't expect something else. I mean, overall, seeing the successes and seeing your completed work is really worth it.
I think very challenging, but also very productive. I think it was a great time for us to really go through the topics and really think more about what we want to do and see how feasible it is in fact. Because sometimes we come with an idea and then we see that this is not what we really can do. So it was definitely for a long time very challenging, but also very productive, as we could see today.
I think we all improved a lot on understanding science and scientific methods. So I think it was a great journey for all of us.
First, I think with the scientific knowledge what we got during our PhD training, it helps us to better understand the scientific articles what we read. So whenever we look for a new method, or whether it's diagnostic or therapeutic, then it gives us the stability to know that which article can we count on, how is it a good quality or a bad quality study. So it's very important to have this knowledge, I think.
Excellence.
Useful. Surprising, I would say.
Great. If there is a second word, tiring.
Much to win from these 15 months. The beginning is always not tough, but okay, with obstacles. But definitely, as time passed, we all become accustomed with the system and we progressed very much. And we had results that can be measured, high quality results. So this is what I would say about the first 15 months.
There are already 13 publications can be found on PubMed from year 1 students after 1.5 years, and from the 13 publications, 5 of them inside the top 10% of the journals, and the other 8 inside the top 10 to 25% of the journals. So all articles are really published in a very high quality level, which actually reflect the aim of the Center for Translational Medicine to be an organized, structured way for high quality science.
In the last 3 months, you know that in the second year they go back to the clinics, they start to work more with the patients. What I see now that they manage to bring the first year knowledge back to the bedside, and I see that knowledge and way of thinking that they already started to use their results in the clinic. So I see the huge progress, and I'm very happy to say that we are expecting at least 10-15 students next autumn to already have the thesis defense.
It is very important part of the program that it not only includes the teaching of the different research methods, but also how to present the newest results and achievements in the field, and that also includes the presentation techniques and English language and grammar and performance, which evolved a lot since the beginning of the program on the individual level as well as on the organizational level.
Now, this program is not the classical university type of kind of examination of getting more and more data out of the squeeze out of more and more data from the students, but they really need to have a kind of complex overview of their topics. And when they prepare for that, that is really a bit of work. So besides doing individual projects, now they have to bring it together. But I'm quite sure that they will all do that very well.
Fantastic.
A journey.
Success.
Brilliant.
It would be just work, because there were a lot of work to do in both fields.
In year 2, the best students got the opportunity to help, to assist and to teach year 1 students in a forthcoming year, which helped them a lot to retain the knowledge they acquired during year 1.
I really love the teaching because it helps the new students, and also it's a team effort, so I always like to encourage them and to build on their strength and let go of their weaknesses, and I want them to enjoy the whole process, so I think that it's a very nice journey.
I would recommend it for anyone who would like to do their PhD studies in a really structured, systematic way with a lot of help of not only their supervisors but also scientific methodology supervisors, statisticians and experts in all fields.
I suggest this program for everyone, of course, who somehow related with the healthcare. So not just dedicated for doctors, but even for physiotherapists or conductor, as I am. So this is a very good combination to learn also about science, about methodology, but you can also work in a practice and you can implement this knowledge that you get in the program in your daily practice.
Anyone who has the desire to learn how to do good science. So anyone is welcome, not only medical students, not only medical doctors. We have a broad area of categories of professionals that are involved in the program. We have dietitians, we have physiotherapists, conductors. So anyone who is interested in learning how to do good science is more than welcome.
I also recommend this program not just for the really beginners, but also for clinicians as well, who are already working for some years, because you can learn many things that you really use after in your practice as well.
The students' presentations improved tremendously during the last phase. They can answer also the question in a much more confident level. So I think during the phase number 5 was really a joy to see how the students develop.
Superb.
Structured.
Concentration.
Crazy.